and serve the needs of nurse educators in the trenches to empower them with practical strategies to better prepare students for practice and licensure. And if you're new to this broadcast, my name is Keith, and I'm the CEO of Keith RN. Have been building educational support tools in collaboration with other educators since 2012, and excited to come to you tonight. I kind of got the joy because I just had a successful final defense for my Ph.D. studies about 2 hours ago, and kind of stacking things tonight with the defense. Successful, and now I'm just one step away from completing my graduate studies tomorrow. It's so excited to do so. So I'm going to share the findings and implications of my study that's on the topic of unfolding case studies on the development of critical thinking in baccalaureate nursing students in a future Facebook Live. Now, the last session 2 weeks ago, we talked about tickets to class as a practical strategy to change culture and get students to come to class prepared. And I know a lot of you found that helpful. And if you missed it, no worries, because all of these Facebook Live sessions are recorded and are available on the Keith RN Think Like a Nurse Facebook page. So if you are on Facebook, you can simply search that, you can like that page, and then you'll stay in the loop with new postings or updates and simply subscribe to this page. Now, I have a really important question for you that some of you have also likely thought and wondered. As a nurse educator, as you look at your students, when they're faced with the difficulties of a challenging major that nursing represents, why do some students overcome and excel while others wilt and ultimately decide to drop out? Now, I'm excited to have a guest tonight. Her name is Marianne Biangone, and she's an experienced educator who has an answer to this important question. And Marianne is also a friend and a fellow student colleague at William Carey University, where we've been attending the last 2 years together, and she successfully defended her dissertation study on the topic that she's passionate about: fostering the non-academic traits of grit to increase nursing student success. And so I'm going to bring Marianne into our chat and see if she's here. And there you are, Marianne. Welcome to Facebook Live. I'm just waiting to see you come on in here. I've got you on air, Marianne. Can you, let's just see what the problem is. Just give us a moment. Technology can be a glitch. We'll get her in. Because without Marianne, we don't have a Facebook Live tonight, because grit is her topic and it's not mine. So I'm excited to have her share what she's learned in her journey. Marianne, I see you smiling. So are you still with me? Awesome. And Marianne, I just want to give a shout out to you because, the wisdom of Solomon stated, 2 are better than 1. Because if you fall down and you have no one to help you get up, woe is that person. And I think that I've probably been a little bit more needy. I've stumbled more than you. But I want to thank you for being there because I've needed that helping hand. So it's great to have you share your knowledge and expertise. And thank you for coming and sharing this time together. Oh, no. You know what, Marianne? I'm not getting you coming in. Your sound is kind of like a hyper pitch. So let's see if there's something. Yeah, and I don't know what is causing that. You know what you can do? Do you want to basically, let's have you exit back and come back in again. Okay, if you just want to use the link and in essence enter back into the live stream. So if you just want to come back out, if you just want to go out and then come back in, we'll get you back in. And so And if nothing else, what we may have to do is basically have Marianne, yeah, she's still frozen. Now, how many of you are frustrated with technology? Because as you know, whether it's Zoom or anything else, things basically can either go well or they don't. And for myself as an emergency room nurse, you kind of got to prepare for the unexpected. And so I'm going to have Marianne, she's going to come back in. What I'd like to share with you until she gets back in is that, I'd like to share just some very simple takeaways from my dissertation study and maybe give you a little foretaste to kind of prepare you for, I think, some further information that we can learn from my dissertation study on the topic of unfolding case studies and the development of critical thinking. And one of the really important takeaways that I think we need to embrace as nurse educators is that we need to strengthen the active learning. We need to strengthen the clinical judgment, and we need to be using active learning strategies. And the thing that's very interesting about clinical judgment is that we have tons of nursing literature on the topic of high fidelity simulation using the skills lab and all that goes with it. And it has been found effective to develop the clinical judgment required for safe practice and licensure. But there's really a paucity and a lack of current literature on the topic of unfolding case studies and low fidelity simulation to develop the clinical judgment, the critical thinking and reasoning that's all required for safe practice. And so when I did my literature review on the use of unfolding case studies, there really was a paucity. That was really the gap in the nursing literature. And so in that context, I essentially identified only 20 studies that really kind of looked at unfolding case studies and the ability to develop critical thinking. What was very interesting is that the qualitative studies, there are only 5, the qualitative themes of student researchers were that they were able to, that students overwhelmingly found case studies and unfolding case studies meaningful and helpful to develop the thinking required for practice. In fact, they found it engaging. They were a little bit challenged by it because any active learning strategy kind of puts you on your heels. You're kind of defensive. And so this is one of the reasons that as educators, we need to, in essence, kind of not go with the first or second week, because our students are used to their whole high school. It was traditional passive learning for most in their programs. And so therefore, when you begin to engage them, you're really pushing them, and they're used to just being on the receiving end. And so this is why we cannot be put off by student resistance, because active learning is educational best practice at the end of the day. And so therefore, as nurse educators, we must embrace and utilize educational best practices, whether our students like it or not. Now, we need to kind of listen to their feedback, but the qualitative themes of the 5 studies that I identified was that they found it helpful, it engaged them, it helped them to see the big picture of patient care, and really strengthened and kind of gave them the practice that they were wanting, looking, and needing as they, in essence, looked at clinical practice. Now, the 15 quantitative studies, what was very interesting, there was not one study that addressed clinical judgment and clinical reasoning directly as using unfolding case studies. And one of the benefits of unfolding cases, and that's just, again, one of many active learning strategies. And so this is one that I've been familiar with, I've developed, and I've utilized repeatedly in my own classroom with my students, and began to develop that kind of the paradigm shifts of Pat Benner from educating nurses and making learning active. But the bottom line is that an unfolding case study can bring in that reasoning and practicing the thinking, just like you do with sterile technique. And so recognize that embracing and utilizing active learning. And unfolding case study is just one of many. You can use virtual sim. You can use principles of problem-based learning, as well as other strategies to develop the reasoning that your students need for practice. So the gap is, we've got nothing on clinical reasoning and clinical judgment. There was just a couple of studies on critical thinking. And what was very interesting that really kind of replicated, that identified with my themes, is that the more case studies, the better. What the studies made very clear, let's say there was one study that had only 2 case studies in the course of a semester. That's kind of like, when you think about it, that's about how many high fidelity simulations our students will get in a typical semester in most programs. If they're doing more than 2, from what I've observed, you're doing very well in your program. What's important to realize is that 2 interventions of unfolding case studies as low fidelity sim had no effect on critical thinking scores, using an instrument called the Health Sciences Reasoning Test that measures these cognitive constructs of critical thinking quite effectively. It's a valid and reliable instrument in the literature. 2 wasn't enough. What was interesting, of the 2 other studies that were in the literature, those studies showed that when you use 8 interventions over the course of a semester, now these were an hour to an hour and a half in length, but every other week, when you utilized a simple unfolding case study and unpackaged it with your students every other week over the course of just 1 semester, they were able to develop statistically significant impact of critical thinking. Now, I've shared enough. That's just a little tease for maybe in about 2 to 4 weeks. I'll have a chance to share with you more, because I've got Marianne. I can see her in the back, and let's see, we're going to bring her on and say, Marianne, how you coming through? Let's talk to me.
Can you hear me? Is it better?
Yay!
I hope it's better.
Oh, wonderful, Marianne. So you know what? I just gave him a few minutes of good information on my study. I don't want to bore him with that anymore. It's good information, and you know that. But your information is what I want to talk about tonight, because really, when you talk about student grit, resilience, I'm going to let you share your story. But really, I just want to get a sense of, for people to know who you are, what, you're passionate about nursing and education. You've done both. I'd just like you to share your story. What interested you in nursing, and then pursuing nursing education? So just kind of share your journey. I'd love to hear it, and provide a context to your study.
I mean, I'm happy to share. I have always had a heart for service. I've always done some type of volunteer work ever since I was young. It was just something that was always instilled in us as kids, part of my family. And a lot of that service was done at church or within the community at large. And so I always knew I wanted to do something related to that, right? And so I thought for a long time I wanted to be a physical therapist, and got accepted to a few programs. And my father had some other ideas and made the recommendation that maybe nursing school would be a better fit for me.
Okay.
And I tried it out, and he was right. It was a great fit. So I'm one of those old diploma nurses. So I went through a hospital program and just kind of steadily worked my way through, through academia and getting degrees and going back to school. My clinical background is ICU. I was a critical care nurse from day one for many, many years, and then switched to public health. I think you and I have had long conversations about that. I just feel like I hit a point one time, and I was working the night shift and just finished coding a patient who I had gotten very close to, and we lost, unfortunately. And I just said, there has to be a better way to do this. There has to be a way to prevent this from happening, which is kind of how I made that shift into public health. So That's sort of the backstory. Nothing super exciting.
What about nursing education, though? What kind of led you to get kind of that gateway into nursing education? Because most of those who are watching are nurse educators. So kind of, what was your entryway into that? And kind of what would be a pearl that you would share about someone who is new in nursing education that would maybe encourage them in their own journey?
Yeah, I mean, every job I've had education rolled into it. I started even as a brand new nurse, I was precepting students and doing continuing education offerings for my peers, and so I always had my hand in it. And one day, one of the nursing faculty that I had while I was in school was making rounds with students, checking on students like we do. And she came up to me and she said, you really should think about going into academia because we think we see what you're doing and you're doing a really great job, which I appreciated hearing. But, my heart was still more in that clinical side. I was young and kind of felt like I needed that adrenaline rush, right? Or validation as a nurse. And I quickly learned that I thrive on cheering others on. I like the development. I like coaching people, and student nurses, as wired as they are, as crazy as they are sometimes, I love them. And so for me, it was an easy thing to get into, and started off like most faculty do, clinical faculty. Did that for almost 8 years before I really got a chance to in the classroom. If there are newer educators on, the first thing I would say is just find your fire and follow it. Whatever you're passionate about. I tell my kids every day, whatever job you do, it shouldn't feel like a job and it should never feel like work. And I haven't worked in 28 years. I mean, I have, but I haven't, right? And so for me, it's just been a labor of love, and I would encourage everyone to find what you love and get really good at it and do it.
And what about with nursing education, Marianne? It's a difficult transition because nursing education is not clinical practice. And so when you have that kind of comfort level with clinical practice, and now you're transitioning to an entirely different role, and now you have students as patients and what that looks like, and that kind of dynamic can be very difficult. And I'm just curious, is there anything you learned in your journey that kind of helped you get through that transition period of the first 1 to 3 years, and that you are now really thriving in nursing education?
Yeah, the first thing I would say is the first year is hard, the second year is harder, and the third year is when things start to settle in, right? So most people, we find that when they are transitioning from the clinical space into academia, the first year is hard, and then they think, oh, the next year will be a little easier, and it's not. It is a little harder. I think partly because you know a little more, people expect a little more, and it just gets busier. And so the complexity starts to build up, and it gets difficult. And by the third year, you settle in. So that's the first thing I would say to expect, and not be surprised by that at all. The other thing I would say is have a little grace with yourself. Remember that you were an expert and still are an expert in the clinical space, but you are now returning to being a novice as an educator, and it's your job to basically soak up and learn, ask questions, find a mentor, watch other people teach and understand why they're doing what they're doing. Anybody can go in front of a classroom and lecture from a PowerPoint or, read off of notes. But it really takes a patient, special person, I think, to be able to stand up and really wait for a student to think through what the right answer should be, or ask them just those right 1 or 2 questions that sort of lead them to the answer almost, so they get that sense of accomplishment without giving it to them, So I think it's just grace and patience with yourself, and over time it comes.
And a lot of students, how did you handle students who really kind of we use the acronym of being spoon-fed. It kind of sounds belittling, but I don't mean it any belittling way towards students. But in essence, many of them want that. They want to kind of, to get them to engage and to think and to pull that out of them, and making that a win-win when they kind of suddenly just want to pass the test and just want to get through whatever your content is. When you encountered that, how were you able to address that in a respectful and direct manner to bring about needed change with that student and even in the culture of your program?
Listen, I mean, I think we're all like that. If we could hit the easy button and things just come in front of us, we would do it, right? I had the students buy me an easy button. It sat on my desk at work for many years. It's one of those things. I mean, it's just human nature, right? I think it's important to set the expectations that you have for students on day one of the class. I think it's also important to level set their expectations, what they can expect of you. I mean, you're going to come every day prepared. You should be committed to that. I'm coming every day prepared. I'm coming every day ready, and I'm coming every day focused to you. I'm giving you my undivided attention for however many hours we are in this classroom. Yeah. And I'm going to thoughtfully listen. I'm going to provide feedback, and we are going to engage. And I'm asking the same of you. So I think when they understand there's a give and take, and they understand sort of that larger endpoint or that goal, the focus moves away naturally almost from, learning to take a test and then move on, because quickly they see that doesn't work.
Yeah. No, excellent. That's great feedback, Marianne. Kind of getting to your dissertation study on the topic of student grit. When you do a dissertation study, you've got to love your topic. You got to be passionate about your topic. Even though, it's a difficult process for me, the unfolding case studies, clinical judgment, it's like I feast on that. Now, you chose student grit as a topic for a reason. I just would love to know your back end story as far as what led you to conduct your research on this topic.
Yeah, it's something you and I have talked about quite a bit. I grew up pretty modest, right? My parents were both working class people, and and with a large family, that becomes challenging sometimes, right? And so we didn't have much, but we had each other, and that was just certainly enough. But, because my parents didn't go to college, and one didn't finish high school, they had a GED. So, which is fine. However, when you have a kid who is interested in kind of academics and trying to learn and struggling to learn, your parents are typically there to help you, and mine had a hard time doing that because they were working. Mm-hmm. And so it made it really difficult to be successful, but I just knew, my parents always had a saying, when things get difficult, you pull up your bootstraps and you find a way forward, right? And I never really understood that for a very long time. And obviously as an adult, you figure it out, right? But then in 2010, I think Angela Duckworth did a TED Talk, and I remember it like it was an hour ago. Really, it was that vividly. It was nearly 20 minutes long, about 18 minutes long. And she talked about having this long-term goal. And by having this long-term goal, people work steadily and slowly to this long-term goal, practicing more and more every day, almost to near perfection until they hit this goal. And it resonated with me so much. It reminded me of my own academic journey. It reminded me of the journey of many students I've worked with. And I just knew I needed to understand more about that and how I could put it in a student's toolkit, help them be successful.
So let's define our terms, Marianne. Let's define what is student grit that's going to set them up for success versus student resilience. People sometimes think that they're synonyms, they're the same thing. And they are similar, but like critical thinking and clinical reasoning, they're separate but interrelated. And so could you help explain what is grit, what is resilience, how they're related, but how they're also different, so educators understand that concept and content and can apply it to students and even to themselves, because we need grit. As educators, we have a tough road, and some of us are roadkill after a year or two, and we just walk away. So we need grit as well. It's not just for students. I know I do. I had my own challenges. So I'd
For
like you to
sure.
kind of define, like you to clarify that, so those who are listening and are viewing, either now or in the future, can kind of understand that.
Yeah, for sure. And it's a question I'm asked often, honestly. So I'll start with resilience. Resilience is the ability to bounce back, right? So something in life theoretically knocks you down and you have the ability to get up, right? That's resilience. It's like being a rubber band. Um, Grit is a little bit different because grit is really setting a long-term goal and having a passion for that goal and being persistent in your interest in attaining that goal. So there are some fundamental things that happen within grit. Persistence of interest and maintaining that path. And the idea is that if you see that, keep your eye on the prize, right, so to speak.
Yeah.
That really helps you in those down periods, right? It reminds you of your purpose or why you're on this journey. And certainly resilience coalesces with that a bit, right? Because in in the process of school, of life in general, there are going to be barriers or something that will knock you down. So we hope that you also have some resilience to understand that, yes, it's time for me to get back up.
Yeah. And so then what can educators do informally? Now, your study had a structure to developing this grit and this resilience and perseverance. And we're going to share that just in just a moment. But when it comes to educators in the, who got students who are struggling, who are maybe just kind of, they're waffling, they're on the ropes like rope-a-dope. And it's like, what can we do as educators to reach out to those students? And what is just a practical one or two things that are the right things to say to kind of get them to get their eyes seeing things differently so they can be set up for success?
I think you alluded to one, and that's reaching out, right? Students will not always reach out to us for whatever reason. They're afraid, they just don't have a bond with that faculty, or they realize they're struggling, and that's going to be an awkward conversation that they're not comfortable with. So reaching out, engaging with that student in a way that they like to engage, right? So that public health adage of meeting people where they are kind of falls here. So whether you're comfortable texting students, IMing students, if you have that as part of your software at school, emailing, of course. They don't often respond to that this generation, but they do like text a whole lot. And so that's the first thing. I say reach out and meet them where they are. That's the most important. The other really important thing, and I say this in all respect, is put your bias aside. Students have trouble for many reasons. I had a student who was late often, and I thought, oh, this person clearly did not hear me when I said I'm all about being on time. So so we had a conversation in it, and it started something like, help me understand where the struggle is to getting here on time every day, because I'm a little challenged. And she basically told me there were 6 people in their house and they had 1 alarm clock, and that alarm clock resided in the room of the person who had to wake up first. And so it was that person's responsibility to go down through the chain and wake everybody else up. And if that chain broke somewhere, then she didn't get woken up and she was late, right? That's tough. That's reality, right? But I had to put my bias aside to really understand that, because I understand that life, right? So we quickly went to the pharmacy next door and bought an alarm clock, and I told her, this is yours.
Yeah.
And you need to be on time.
Yeah. And it's kind of like everybody's got a story. There's a back end story, and to just look at what's on the front cover in the window dressing isn't the true story. And we can make those assumptions so easily. I mean, we're human and we do it. So we just have to be honest with ourselves as educators. We all have biases. We just either are humble enough to acknowledge them, or not. And from what
Right.
I've observed, no, great point. Tell us about your study, Marianne. I want to know about, your dissertation study, just the very essence of it, kind of what you did, and what are some, maybe some takeaways for educators from that study. So I'd love to learn more about that. And so please let us know.
Yeah. So there are 4 characteristics that make up grit: interest, practice, purpose, and hope. And the thought is if we could educate students on what those 4 characteristics are as they relate to grit and also as they relate to the nursing program and their point in time of the program, then they could potentially grow the amount of grit that they have from the beginning of the study. And so for me, I'm always very interested in first year nursing students. We know that's where the highest attrition rate is. And so we always try to hold on to them as much as we can. We know there are evidence-based models out there for accepting students, and we use them, and that still doesn't seem to do the trick. And it's not that the model's bad, it's just life happens, right? Or you say the backstory. So after identifying this, I delivered the GRIT-S assessment that Angela Duckworth had developed and delivered that to the participants, all of them. And once that was done, I had broken everybody up into an experimental and control group so that we could determine if after watching these sort of modules that were created to talk about each one of those characteristics as it relates to grit and nursing school, if on the post-test when it was delivered they would have a higher level of grit. And I'm really happy to say that after 6 weeks of watching the videos, being provided reflection questions and thoughts to ponder, the students had a marked increase in grit at the end of the study. So that was really exciting. And I'm really looking forward to replicating that study with a larger sample size.
So in principle, what your study showed is that grit can be developed. It's not like you either have it or you don't, and you fail or you don't. Actually, if we can kind of teach some of those skills of grit and resilience and helping our students work through that, we can improve student success and retention. Is that a fair assumption, or is that would that build on the essence of what your study findings demonstrated?
Yeah, exactly. And, at the conference, I'm going to talk a lot about at-risk students and the philosophy of at-risk students and how that works with grit. We know there are many reasons why students are not successful for the first year of school, and it's not just academic underachievement.
Yeah.
So, it was an interesting thing to explore, and I'm excited to share more of that for those folks who can attend the conference.
Yeah, and that's going to be on August 13th. That's a virtual conference that Keith RN is sponsoring. It's going to be a half-day event. It just went live a week ago. So those of you that get my updates have gotten some emails, but Marianne was actually the first person I reached out to that I wanted her to attend. And now her topic is so relevant for the beginning of the school year because, we have a nursing shortage and we have to retain as many as possible, in the right way at the beginning of our programs in that first year that is so crucial. And so I'm excited to have Marianne share, I think for the first time, her work on that topic and some of the practical pearls and strategies that you're going to bring based on your study. But if you're to leave educators with just one pearl, Marianne, that you're going to maybe build on, so like, a really important concept or principle that you're going to build on from your session in this virtual conference, what would in essence that be?
That's a great question. I think I would just share that at risk is relative. And I think that it's important to understand that there are more than meets the eye when it comes to student success. And students will need every tool in their toolkit in order to be successful. And And, nurse educators are perfectly suited to help students develop in that way.
And so there are things that they can learn that they can basically then incorporate into their practice as educators so they can kind of implement like you do a patient. You've got a patient, you got to implement the plan of care. But you have to establish and you have to reach out and do it. It's kind of like the same thing with our students. They're not patients, but they are our priority. And we need to do what we can to set them up for success. Is that a good understanding of the essence?
Yeah, I mean, at the end of the day, anyone that's an educator will tell you the students are at the center of everything we do.
Yeah.
And if we miss that point, then we miss what we're doing and why we're doing it. So, yes.
Awesome. And you know what? Just stick around for a couple minutes. I'm just going to kind of close here, but Marianne's going to stick around for questions. And so I've got the chat box here on the on my right here. And so I want you to be thinking about what questions do you have as it relates to your experience with at-risk students or student success, and any questions that you have for Marianne. She's going to stick around. But I want you to just want to highlight briefly that that Keith RN is sponsoring a virtual conference. This is the first time I've done this, and so I'm excited to really have the emphasis of Prepare for Practice 2020, and the subtitle is Successful Strategies to Develop Clinical Judgment for Practice and Licensure. And this half-day virtual conference will be on August 13th, 2 weeks from today, from 9 a.m. to 1:45 p.m. Central Time. That's really going to empower you as an educator to help students develop not only the grit and the resilience that they need to be successful, but also the clinical judgment required for safe practice and licensure, and best practice strategies to really develop that judgment both online and in the traditional classroom setting, which I hope that we'll get to soon. And so Marianne's going to be sharing more on this topic of student grit. Will be one of the hour sessions. Sally Kennedy, the author of Designing and Teaching Online Courses. This was one of my favorite textbooks in my doctorate program. She's got 2 topics that she'll be presenting on: operationalizing the science of learning to strengthen student understanding of essential content, and how to create and facilitate case studies that engage the smorgasbord method with Socratic seasoning. And so I'll be presenting as well on unfolding case studies to develop clinical judgment in the class and online setting. And if you'd like to learn more, simply go to keithrn.com. You'll see the link for the button on the right-hand side, and check that out. Tomorrow, I should say, is the last day for early bird pricing. So get that information if you're interested. I'd encourage you to jump on board before the price goes up gently after the August 1st. But if you are a member of the all-inclusive membership, Think Like a Nurse, or have a departmental membership, you have a coupon code that gives you a significant savings. And I've shared that by email. But if you haven't received it or have questions, please email me at keith@keithrn.com. And so next Thursday, Dr. Sally Kennedy is going to be with me on this live stream. So next Thursday, 1 week, not 2 weeks, but 1 week from today, and she's going to be sharing some very practical insights from her book that are really relevant for any nurse educator. Though the focus is online, I found this to be an immensely practical book, and she'll be sharing what she'll be presenting as well next week. But as we look at Marianne and what she had to share, what was your big takeaway? And what questions do you have on improving the success of students and students' grit? And so I'm going to bring Marianne back here, and I'm just kind of to see if anybody has any questions. I don't see anything at the moment, but sometimes there's like about a 30-second delay, Marianne, so it's kind of like the internet just takes a little time to catch up. And so let me just, I've got a great question right here, and thank you for sharing. This is from, let me just, I'll pop that on the screen. And this is, the question is this, Marianne: can resilience be learned? When you are talking about teaching grit, how many hours would be needed?
Mm-hmm. So I think those are great questions, Melody. Thank you. I know that grit can be learned, right? I know that the studies that were done prior to mine really show that with maturation and over time, grit can be grown or developed. So resilience, I would venture to guess, right, can be as well. I think part of that is just modeling behavior, which is leading to the second part of your question. It doesn't take hours and hours. When I share with you about the interactive modules I created, they were 10 minutes each. And so having students just get snippets every now and again of that information, but more importantly, one thing that students are challenged with is reflection. And so reflection is a good opportunity to kind of think through the key elements that they need to think through and apply it to today. The other challenge is making it making it significant or understanding the why or how it impacts them. So having the right conversation at the right moment within the program is also helpful. But it doesn't take hours. It just takes just a constant nudge and challenging on occasion. Sure, I'm happy to repeat the 4 characteristics of grit. They're interest, practice, purpose, and hope. It's funny, the students that participated in this study, especially the experimental group, they were very candid at the end. I asked them to provide feedback. Were there any improvements I could make in the modules? And, I knew they weren't super flashy, but they were, serving the purpose, I thought. And overwhelmingly, I mean, they just loved it. I had a student actually tell me that they feel more empowered to be successful in the program. And so for me, that was just made it all worth it. It made the entire doctoral program worth it almost, just to make sure that, if there's one person that can internalize the message and the information and really apply it, graduate, become a nurse, that to me is so worth it. Yeah. See, my challenge is having students engage online. What can I do to keep them engaged? Ooh, that is the $1 million question, Sandra. I'm doing that every day right now. I'm teaching research, and so it's not the most flashy topic, and some parts get a little difficult, as you know, I'm sure, and it's really difficult to do that. You'll hear from Sally next week, but for me, I think one of the key things for me is creating community and making sure that students know that it's okay. I want them to have their cameras on. And a lot of students won't turn them on because they're either, I don't know, not embarrassed, but they're challenged maybe by their background, or they don't want you to see their kids flying through or making funny faces in the background. And I let them know right at the beginning of class, I need your camera on because we need to be able to see one another and kind of connect. And the other thing is I love a good cameo. So if your kids are around, tell them pop their head in. I'm going to stop and say hi. And on a few occasions I've done that. It's all about being flexible and being understanding. And it's probably one of my favorite things that happen. To the point where I have 2 kids that are in college, and my son was here one day visiting and came behind me when I was teaching and had a cameo, and everybody just got a good chuckle out of it. And he stopped for a minute, said hello, and then marched on. So creating sense of community in whatever way you feel comfortable in doing that is so special and so very important. That's just how I choose to do it. Mm-hmm. Have you published your study yet? No, Marcia, I haven't. I like Keith, my last class is tomorrow, and I graduate on the 15th of August. I'm working on a manuscript right now to get that sent out to hopefully a few different magazines so I could potentially get it published. Fingers crossed. But I'm working on it.
And you know what, Marianne? That's the last question. I'm seeing there's a lot of love here, a lot of thank yous. And basically, one question here from Don. I'll basically pop on and I'll shine out.
Okay, it says, I've used breakout rooms and hear how engaged they are online. I love a breakout room. Not only using them as faculty, but as a student. I recently went through Team Steps training. You may be aware of it, right, for safety and communication. And the facilitator of Team Steps, which isn't a program that's traditionally done online, used breakout rooms, and they were the very coolest experience. They clicked a button and away we went, and it opened up, and there were 6 of us in a room. We got to engage and talk, and then we got a notice that said, you're being put back into the big group in 10 seconds. And after that countdown was done, it closed off and got us right back into the big session. And I really enjoyed that experience as a student. So Don, I hope your students like it too. It sure was fun for me. It was a great way to keep them engaged. I'm teaching communications to healthcare aides this fall. First time teaching this course. Any hints for success? I would say do a lot of listening. I find that listening with intention to students helps me navigate where I need to go. And I'm sure, June, you know the basics, right? It's just being organized and being prepared, understand what it is you want to deliver, and remembering that the very most important thing to focus on, aside from our students, is, understanding what the course outcomes are and what the outcomes of that particular content area are. And then really working towards that, create your assignments that you can actually measure to say, oh yeah, the student met this goal, right? So a perfect example is one of the outcomes of the research course that I'm teaching is that the student will be able to understand evidence or understand and read research and then apply that evidence to practice. And so it's like, geez, how am I going to measure that? Well, my students had to go and they had to look up an article. They had to read that article, and then they had to write a 2-page paper. So quick summary of what happened in the study, what was significant about it, and then would they or would they not apply it to their practice and how? And if they wouldn't, why not, right? So I can understand that they really understood how to break down that article. So if a student can successfully do that, they've sort of achieved that goal for the course, right? So that's really one of the biggest things, keeping the students in the center, being organized and prepared, and looking at those course outcomes and making sure you're creating assignments that really will walk students to there, and that will ultimately lead to their success.
Excellent, Marianne. And you know what? That was the final question that's come through. But I do have one final kind of closing. Angela, I never heard of Angela. Is it Wentworth, Duckworth? What is that name? And spell it for our audience. And then basically, is there a website that is probably the best resource for Wentworth's work for any educator who would really like to build on this knowledge? You've done a great job, Marianne, of just presenting this information, but going straight to the source of, I think it's Duckworth, right? And spelling that and give us some closing resources that we can go to basically learn more right from the source.
Yeah, of course. So Angela Duckworth is, I should say Dr. Angela Duckworth is a professor at the University of Penn and in Pennsylvania. And so she did this research and really has a great plethora of information. So you asked how to spell her last name. So quack like a duck. So DUCKWORTH, Duckworth. She has a website. I think it's angeladuckworth.org maybe. Just if you Google Angela Duckworth, it will be the first thing that pops up. You can actually take the grit test for yourself and see how gritty you are. And then she has some resources on there for you that her material is primarily geared to K-12, right? The younger student group. And my interest obviously is with older students. So when you read her material, it's wonderful material, but just know that you'll have to translate it up to an adult learner, which is not difficult to do. The other thing is she published a book, I think it was in 2016, if I'm not mistaken, that's simply called Grit. It is a fabulous read. It is something that if you see mine, it's bent, it's highlighted, it's has some wonderful pearls in there for not only students but for yourself and just life in general. It helps you look at things through a very different lens. At least it did for me.
Awesome. And you know what? You got a lot of love here, Marianne. Thank you both. A very good session. So you know what? A lot of this, and you know what? A lot of love. So Marianne, it was a pleasure having you on this Facebook Live. I'd rather, you know what? They need less of me and more of others. And so thank you for being the other. And I want to make this an ongoing trend on these Facebook Lives. So if you're a nurse educator, you've got something to share, a dissertation study of your own that would benefit educators, just email me at keith@keithrn.com, and I'd love to give you this opportunity to share your work with the world. So Marianne, thank you so much, and look forward to finishing our final day tomorrow and put this behind us, but we also have a future looking ahead. So I'm excited as well, and blessings to you all. Thank you for watching, and we'll see you next week as we talk with Sally Kennedy, Dr. Kennedy, and what she can really share some powerful strategies with online teaching and learning, which many of us are unfortunately being forced to do, ready or not. So she's going to help you be successful in that transition. So blessings to you all, and have a great night. We'll talk soon.